Good evening, ladies and gentlemen. My name is Lindsay, and I'm a registered nurse from right here in North Carolina, in Congressman Richard Hudson's 8th District. I come to you this evening to discuss the people in our communities, about problems that many of them may have that we do not know about, problems that cannot be seen by the naked eye. Many people right here in our neighborhoods are suffering from opioid addiction. These are our family, our friends, our neighbors. And what if I told you that we can do something to help? Alcohol and drugs are a huge problem right here in the United States. Alcoholism was a contributing factor to the death of my biological father. I was only 25 days old when he died in a car accident related to drinking and driving. I never got to know him. And many children in the United States and right here in North Carolina grow up not knowing their parents, because now people are being found in their vehicles dead, lifeless, lives taken, with children strapped in their car seats in the back. And do you know the reason for this? Drugs. Opioids, more specifically. The opioid crisis has been declared a national public health emergency, and rightfully so. In 2017, almost 50,000 individuals in the United States succumbed to the effects of the opioid epidemic. North Carolina accounted for 2,000 of those deaths. That was according to the National Institute on Drug Abuse. North Carolina houses 4 out of the 25 worst cities for opioid abuse in the United States. Fayetteville happens to be one of those cities, and I have been on the forefront of what opioids can do to individuals in our communities as a former RN in the emergency department at Cape Fear Valley Health in Fayetteville. I have seen people carried or wheeled in lifeless and blue. Many of them walk out seemingly unscathed. Others, however, not so fortunate. The crisis is real. It does not discriminate. Our state is suffering, and the bottom line is that we need to do something to help. The Securing Opioids and Unused Narcotics with Deliberate Disposal and Packaging Act, also known as the Sound Disposal and Packaging Act, is a bipartisan bill that was introduced by Congressman Richard Hudson. This bill aims to provide improved methods for packaging and disposal of opioid medications. These efforts are to help prevent misuse and diversion of opioids. One example of a way that everyone in the community can help with the problem of the opioid epidemic is a product called Dispose RX. And what this is packets that would be distributed at the pharmacy whenever patients are prescribed opioid medications. The biodegradable compound in these packets would render medications unusable when water is added. So people would place medications into the packets, add water, and then they would be able to throw them in the trash. Easy as that. Anyone can do it, and it would help solve this horrible, horrible epidemic that we have going on right in front of us. In 2017, an astonishing $2.5 billion was spent on unintentional opioid-related deaths in North Carolina alone. This is a $1.2 billion increase from the year 2015. Emergency room visits have almost doubled since 2010 in North Carolina, and in September of this year, an alarming 556 emergency room visits was due to opioid overdose. Efforts to decrease the amount of opioid medications in North Carolina homes can drastically reduce the diversion of opioids, thus decreasing opioid overdoses and healthcare costs, respectively. Of the 200 million opioid prescriptions written every year, 92% of individuals do not fully complete their medications, so they're sitting there in their homes. Only 10% of individuals know how to properly dispose of opioid medications. Can you imagine how many lives that we could save by knowing proper ways and having these availabilities of disposing of medications properly? 60% of individuals who misuse opioids do not have a prescription, so they're obtaining them from family members, friends, off the streets, from people they don't even know. Passing this legislation could potentially save thousands of lives. Healthcare spending will also drastically decrease if we can get as many of these opioids possible off the streets and out of homes. There are countless sources of funding available to aid in combating the opioid crisis. The majority are federal funds, and these include the Centers for Disease Control, the Department of Health and Human Services, and the Comprehensive Addiction and Recovery Act, also known as CARA. According to to Health and Human Services, their Substance Abuse and Mental Health Services Administration provides state opioid response grants, and prevention strategies are included in the coverage of these grants. For this year already, in 2019, over $12 million in grant money has been awarded to North Carolina. The CARA authorizes over $181 million of new funding annually to fight the epidemic. According to the Centers for Disease Control, or the CDC, North Carolina is one of 29 states that is funded through the CDC through their Prevention for States program. For prevention related to the opioid crisis alone, the CDC awards up to $1 million annually. As you can clearly see, the opioid epidemic is running rampant, taking as many lives as it possibly can, and it is financially impacting our state and the healthcare industry. We, however, have the available funds to help put a damper on this beast of a problem in our state. We can get millions of opioids off the street with simple yet effective interventions. Give our children the opportunity to grow up knowing their parents. Help to save those in your communities. Thank you.